Hi, thanks for tuning in to the CPHC News Channel. We're super excited today to talk about the pelvic exam for women. One of the #1 questions we get when people call us is, what happens when I come in for my exam? What are you going to do? So I'm going to walk you through that today to hopefully ease your mind and answer some of your questions. Certainly there are other parts of the exam, but this video is specific for women and for the pelvic exam itself. So first what we're going to do is take a look at the muscles and observe. So I'm watching with my eyes to see if you can squeeze your muscles, if you can push your muscles like you do when you have a bowel movement. Don't actually do that. And then I'm going to see what your general coordination is. When I do the external exam, we do something called palpation, which is a fancy word for touching, and I'm basically going to touch the muscles and the nerve structures on the outside to see if there's any sensitivity or if it reproduces some of your symptoms. If you've had a baby and you have any scarring, then I'm going to touch that as well to see if there's any tissue restriction or sensitivity. We do also check sensation and reflexes, just like you check with your leg and your arm. We use a long cotton swab to touch lightly on either side of the vulva, as well as around the entrance called the vestibule, and that checks for decreased or increased sensation and sensitivity. For the internal examination, we use lubricant and gloves, and if we insert one finger, you can see hopefully that I can get into the deeper layers of the muscle and check again for sensitivity or soreness, as well as for strength and coordination. We check both the right and the left side. Now, for people who have pain, if you're nervous about doing all of this in one exam, don't worry, we only go within your comfort and we meet you where you are. For those women who a rectal exam is appropriate for, we may keep you in the same position, or we may turn you on your side or even on your belly to be able to access the structures here. I hope this was helpful and answered some of your questions. If you have any questions, give us a call and we'll see you next time.